The soaring costs of private healthcare is applying massive pressure on NHS GPs, a survey has found. I'm going to read into this exclusive from The Guardian, guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is REGANELITE here with an exclusive from The Guardian with the headline that soaring private healthcare use is piling pressure on the NHS GPs, the survey finds. The exclusive reveals that doctors are increasingly having to interpret questionable private tests and conduct follow-ups. So obviously this is a survey, so I do have to stress that before we read into it, of course. And obviously, our National Healthcare Service, as we have spoken about on a number of occasions, has been under intense and immense pressure. And as we pretty much are diving straight into the winter season, we're practically almost into it at this point because the temperatures are cold. This means more people are going to be relying on healthcare, and when the healthcare is not there, they turn to the private sector. Now, for some people, they can afford it. But for others who are on the low end of thresholds of income, they can't afford it at all. And then you have a situation where massive amounts of people will be piling on pressure from the National Healthcare Service to provide the service to them. Not everyone can afford to go private, and this is a real concern indeed for people. So on that end, it's not good, and especially that people should not have to pay for healthcare when we already pay for healthcare through a tax system, through our national contribution. So it doesn't feel right for me. But I know it's different in other nations. For other parts of the world, they have different systems in place when it comes to healthcare, because everything has to come at a cost, and I understand that. But that's the whole point of why we have a national insurance that we all pay as a tax in that funds our national healthcare service. That's how it works. Obviously, that's the idea, but obviously our NHS is pretty much on its knees at this point, and they're trying to. The government itself are trying to push people into private healthcare and basically want to rip apart anything of a national healthcare service, because they want people to flog their own money and pay for it, and for these companies to make a profit off it. Yeah, I know, it's not good, to say the least, guys. So the soaring use of private healthcare for tests and treatments is piling pressure on overstretched GP surgeries, with family doctors warning that the standard NHS care is being squeezed as a result. The record number of people are paying for private healthcare, with some having procedures such as cardiac surgery and hip replacement, amid mounting frustration at the NHS hospital waiting list. Others are opting for private health checks, generic testing, or cosmetic surgery such as liposuction. But the surge in private healthcare is increasing the workload of GPs, many of whom say they are increasingly having to interpret questionable health checks done privately, organise blood tests or scans, or manage additional administrations relative to private care. Some say more of their hours are being taken up providing follow-up appointments after patients pay for treatment or surgery abroad. One GP said that NHS general practice is being abused and subsidising lucrative private practice that is charging patients extortionate fees. Another family doctor said having to deal with questionable medical requests for patients from private healthcare providers is that we don't clinically agree with, was taking time and appointments away from standard NHS patients. So the other thing as well is important to highlight here, as it's been pointed out here, is that basically it's the same GPs are being used for both NHS and for private, and the same area, and that doesn't sit right with me. Because our NHS is already, a lot of it's already in the hands of private. It's just unnecessary stress is what it is. It's not good. It's really not. Dr. John Puntis, the co-chair of the Keep Our NHS Public campaign group, said, "This is a sorry picture of not only of hard-pressed GPs having their workload and stress levels unnecessarily increased, but also patients duped by the private sector into paying out cash for sometimes dubious tests, diagnosis and procedures without adequate provisions for following up advice and care. The workload of almost half of GPs has grown as a result of people using more private healthcare, according to results of a survey reviewed by The Guardian and undertaken by Pulse, Family Doctors magazine. In the survey of 860 GPs, 46% of family doctors report that their workload has increased amid the surge in private healthcare use. 1 in 10 said their workload has significantly increased as a result. Dr. Emma Nash, a GP in Portchester, Hampshire, has seen a huge increase in workload relating to private healthcare. First is additional administrative workload for us, things like blood test requesting and reviewing results and communicating, as well as time spent reading extensive reports. This extra to our usual already excessive workload. However, the most frustrating bit is when we receive reports or requests that we don't clinically agree with or don't understand the rationale behind. These do take appointments away from NHS patients because once we've received information, we can't unknow it. Nash says this mainly applies for when someone has a vast array of tests with a private health firm who then leaves it to a GP to discuss the results with the patient. It just takes up so much time. That's the thing. It takes up so much time. Other time spent on consultations where the private clinician has recommended a referral. Sometimes this is inappropriate because the patient doesn't meet the criteria. Other times it should have been done by the private clinician. This can be a challenging consultation, again one that wasn't necessary. Requesting tests is more than just ticking boxes, Nash said. We become legally responsible for reviewing, interpreting and acting on results, which is time consuming. She added, although we are not obliged to do these tests or prescriptions, it can be very difficult when a patient has been told what to expect. The NHS has to pick up the products of private work, however appropriate or inappropriate they are. While not all aspects of this take away time provisions for standard NHS care, many do. It's also a psychological impact of this workload too. We're already swamped with our own work NHS generated, but this is an accelerating problem that is eroding morale and contributing to burnout. And this is in part is also what's killing our NHS as well. The burnout of staff is what's causing them to basically quit the practice altogether. Dr. David Coleman, a GP in Doncaster, said private ADHD queries alone were generating a couple of extra hours work every week for the practice at the moment. Dr. Zain Soon, a GP in Kent, said NHS general practice has been abused and subsequently ludicrous private practice that is charging patients extortionate fees while expecting GPs to soak up the complaints administration work pro I don't know what that word means, sorry, because it's pro bono. This is ridiculous and makes the farce of the NHS and the taxpayer. Yeah, it does. It's so infuriating, guys. That why are these synced in together like this? It's because of it's just not fair that we pay for national contribution to have a healthcare system there for us whenever we need it for our needs, and instead of that we're having it being overswamped by these private companies, some from America, who are forcing these issues, forcing private healthcare on top of already the work that they already have, and ripping people out of their money. Literally ripping people out of their money just to be healthy and happy. This is the same people who are already contributing to a national and this is some of these people who are paying for private healthcare who are already contributing to the national healthcare service but not even getting that national healthcare service because of how much the NHS has been ripped up, how much has it been privatised. They're essentially paying a tax for nothing at this point, because they're forced to go private, some of them. And these members of staff who happen to have to deal with both NHS and private is ridiculous. It should not be happening. It should be separate. That's how it should be. Sai says the current guidance on the private NHS interface was laughable. Nash said the rules were not fit for purpose. Kat Hobbs, the director of public ownership campaign group We Own It, said, "We need the government to reinstate our NHS as a fully public service and fund it properly. Otherwise, we will continue to drift into a wasteful American-style two-tier system where our GPs increasingly can't cope." Professor Kamala Hawthorne, chair of the Royal College of GPs, warned that the UK must guard against creating a two-tier system that favours those who can afford to pay and disadvantages those who can't. But said she understood why some patients facing NHS wait turn to private healthcare. Many private clinics back up results to the NHS, often via general practice, to be assessed and follow up, she added. Some private companies routinely advise clients to routinely speak with their NHS GPs about their results or treatment, even when this has gone well, further adding to workload and leaving other patients facing even longer waiting times for a GP appointment. Exactly, this is just putting more pressure on the public and public workers. This is what it's doing. It's so infuriating that our NHS is come to this, guys. It really does. I just wish this would stop. I really do, but it's they're so embedded and so entangled in our NHS. These private companies, these private the whole private healthcare thing. You know, it's just it's a spiral. It really is, and I deeply sympathise with the patients. I deeply sympathise with the workers, and I deeply sympathise with everyone within the National Healthcare Service who want to do good, who want to continue to try and their best to give the best healthcare possible, but are being absolutely swamped by effects of not only the private healthcare, but the lack of equipment, the lack of bodies, the lack of so much austerity had been placed on them since 2010. And this winter is going to be absolutely horrible for them, as if the pressure is already not enough for them, having to work such extraordinary, extortionate long hours in order for them to keep up with the workload is absolutely insane, guys. It really, really is. But what do you guys think? What do you guys think of all of this? Do we need to separate these two? The fear of a two-tier system in America is something that that is definitely on the back of my mind. What do you guys make of it all? Let me know down in the comments section below. Like, share and subscribe as always. Thank you very much for watching, and I hope to catch you all very, very soon.